Hello and welcome to another episode of Local Expert Interviews. My name is Michael Grady, and today we're going to be speaking to Dr. Rondi Walker of Walker Plastic Surgery in Washington, D.C. Dr. Walker takes a modern approach to plastic surgery, which combines technical surgical expertise and a refined sense of aesthetics. Dr. Walker is a superior listener who can sensitively understand the needs of each person's plastic surgery needs and offer the best course of action. Welcome, Dr. Walker.
Hi, thank you, Michael. It's a pleasure.
Dr. Walker, please tell our viewers a little bit about yourself and your practice in D.C.
I have been in practice in Washington, D.C. for the past 20 years. I am originally from Washington State, but I did my my residency training at Yale University and Georgetown University, which is how I ended up in Washington, D.C. I specialize mostly in cosmetic procedures, which include facelifts, mini facelifts, fat augmentation, liposuction, breast augmentation, breast reduction, tummy tucks, really the whole gamut of plastic surgery. And I also do take care of some of the children who have been injured in this area as well.
You're doing God's work.
Thank you.
Today, I'd like to talk to you about facelifts.
All right.
What is the difference between an S-lift and a mini lift?
An S-lift is another description for a mini lift. Basically, it is a mini lift. It's just the difference is that the S describes the incision, okay? And an S-type of skin is removed when you do the S-type lift, which is what you also do in the mini lift. So it is just another description for the type of incision. If the incision is a little bit longer and you have to go down and around the ear like this, it becomes more of an omega lift. Really, the amount of skin that is lifted up or undermined to pull back determines if it's a mini lift or a full facelift or just a micro lift.
I understand. Well, let me ask you then, who is a candidate for a mini facelift?
Usually a mini facelift is somebody who's on a little bit on the younger side, but it truly is an individual thing because some people age differently. But in general, it's women or men in their, say, late 40s to mid 50s or so who just want a little bit of tightening. They're starting to notice that their face is starting to just square a little bit, getting a little bit of jowling in here, and a little bit of loss of the volume in this area. So it just need to have a little tweak or a little touch, a little pull like this. It just takes it away, maybe a little tiny liposuction along the jowl line. And then usually with most of my facelifts, I include fat augmentation to the malar region or the region along the cheekbones.
Well, speaking of volume loss, I understand that that can be an issue. So when you perform the smaller mini facelift, is volume loss a problem?
Volume loss is a problem. It depends a little bit on the patient. A lot of patients have a very high cheekbone and their fat has not shifted. But in most people, when they hit mid-40s, the fat starts to fall and to shift. And that makes you look gaunt and hollow. And you lose that sort of bloom of youth, that full cheek, which is why everyone looks better when they're smiling than when they're just sitting in repose. So I usually do include fat from the patient's own body, taken from the abdomen or the upper hip, when I'm doing a facelift procedure.
Can you talk to our viewers a little bit about how do you actually treat the volume loss?
Well, the volume loss, as I mentioned, in a facelift procedure, I treat by injecting the patient's own fat. But if a patient comes in and they just have minimal volume loss and they're really not a candidate for a facelift and they don't want to have a more aggressive procedure, then we'll use one of the fillers, the hyaluronic acid fillers. And usually if it's a lot of volume loss, heavy volume loss, I'll use something like Radiesse or Voluma C, the new Voluma, and that's mixed with calcium chips so that it stays a little bit longer, and it's injected very deep next to the bone. For patients who just have finer, small lines, little nasolabial folds or the little marionette lines, I will use a lighter filler, something like Restylane, Juvederm, Belotero, one of these types of fillers that's much lighter. And that's how I treat the volume loss.
Well, once somebody has the procedure done, what's the recovery time?
For a mini facelift's about a 7-day recovery time. You have a dressing on for the first 48 hours, and then it comes off. And then the sutures are out by the first 3-4 days, and then there's a couple of little smaller sutures that stay in for about 7 to 10. But most people are able to go back to work with really very little downtime.
What are some of the issues in recovery time? Let's say somebody's a smoker. Does that affect the recovery time?
Smoker definitely affects the recovery time, but it also affects how much skin that we can resect, because the nicotine causes the blood vessels in the skin to become contracted, so you don't get as much blood to the skin, so the skin is not as healthy. So you have to worry about people losing skin, and you want to undermine a bit less in those patients.
So let me ask you then, what's the most important thing for a positive outcome when they're having a facelift?
I think for a person to be in good health, for a person to allow for the amount of time they need to recover, and also for a person to have researched their surgeon. If you've been referred to your surgeon by your own doctor or a friend who's had surgery by that surgeon, that's also a good sign. And also make sure your doctor is board certified by the American Board of Plastic Surgery.
Dr. Walker, I would like to thank you so much for this interview. You've given us a lot of great information on facelifts and mini facelifts.
Thank you very much. Goodbye.
Again, my name is Michael Grady. This has been another episode of Local Expert Interviews. We've been speaking to Dr. Rondi Walker of Walker Plastic Surgery in Washington, D.C. about facelifts and mini facelifts. If any of our viewers would like to get more information about any of these procedures, please refer to the phone number at the bottom of the screen. Again, thank you, Dr. Walker.
Thank you, Michael. I appreciate it.